Still another reason for stigma is the belief that the mentally ill are prone to violence. Scientific researchers have proved that this risk is small compared to other causes of violence, although a tendency of violence may be seen in some extreme forms of mental illness. For example, in paranoid schizophrenia. This is a psychotic type of mental illness in which the individual is deluded and may believe that malevolent actions are directed towards him or her. Violence can also be manifested by people who abuse psychoactive substances. Most often, the violence is directed towards known family members and rarely strangers. The meaning of this is that you do not need to run away from or avoid the mentally ill. Most types of mental illnesses rarely manifest violence. Let us be critical. How many patients with psychosis roaming the streets have you seen attacking people? In my almost 20 years of practice in psychiatry, only one of my patients was a bit physically aggressive towards me, and she hurled a small chunk of bread at me. According to research findings, the overall contribution of mental disorders to the total level of violence in the society is exceptionally small. In fact, research also shows that the mentally ill are more likely victims of violence rather than perpetrators. People avoid interacting with, or working, or living with, or employing, or marrying people who have or have had mental illness. They are seen as outcasts oftentimes. Societal stigma also leads to self-stigma. Self-stigma rather is when someone with a mental disorder has negative beliefs about their illness, leading to more negative emotions within. For example, reduced self-esteem and confidence. So they experience two kinds of challenges. Challenges posed by the symptoms and disabilities that accompany the illness, and challenges of the stigma that encapsulate mental illness. People who self-stigmatize resign to fate and may not do enough to help themselves and tap the opportunities that surround them. Therefore, the quality of life they live is significantly further diminished. Stigma is the greatest obstacle to proper mental health care. Being mentally ill should not take away the dignity and respect for the individual. It does not make the patient less human and should not diminish the rights of the ill person. It is very unfair, inhumane, and barbaric to stigmatize the mentally ill. There is an abundance of scientific evidence that prove beyond any dot of doubt that mental illnesses are biological illnesses like other bodily illnesses. What makes us different as humans from other living forms is our superior and sophisticated mental functioning and capacities. The organ that allows us to achieve this is the brain. The brain is a seat of thinking, emotions, and purposive behavior, and the mind is the symbol of structures within the brain that serve these functions. What I am saying is that it is the mind that defines us as human beings. The brain is the organ of the mind. Mental illness arises from problems within the brain and should be seen like other illnesses of the body. Diabetes, hypertension, arthritis, and some of the illnesses that humans experience. No one stigmatizes any of this because they are recognized as biologically based bodily illnesses. So, why should anyone stigmatize mental illnesses, which are also bona fide biological illnesses of the brain? Stigma leads to shame, and the natural response to this is secrecy. That is, if someone has a problem and he or she knows it will be stigmatized, the probability of keeping that problem as a secret is high. Stigma is also responsible for why some people, even though they know that they have mental disorders, still will not go to the right places or approach the right professionals like the psychiatrist for treatment. Rather, They would go for treatment in places no one will associate with mental illness, like going to the spiritualist, counselors, life coaches, therapists, and so on. Unfortunately, most of the time, these helpers only have a superficial and wrong knowledge of mental health matters. This unqualified group of helpers offer unscientific, questionable, fake treatments that most of the time do not work or only give temporary and superficial relief. At the end of the day, they waste patients' time and resources, which should have been properly utilized for the right and effective treatments. The elixir or antidote to stigma is massive and consistent public education by qualified mental health professionals and people seeing the proof of effective treatment by interacting with people who have recovered from mental illness. Having the right knowledge will let you make informed decisions when problems arise, and there will be less confusion and less likelihood of being defrauded by quacks parading in different titles such as unspecified therapist, mind expert, emotional therapist, autism expert, and so on. The summary of everything is that mental illness can happen to anyone. Stigmatizing mental illness is primitive and inhumane. Effective treatments are available. Full recovery is possible, and the individual can go on to achieve his or her potential in life. Well-managed mental illness does not truncate one's desire, dreams, and goals. Thank you.